Please join me for Ask the Good Doctor, live today and every Wednesday at 1 p.m. Eastern Standard Time, 12 noon Central Standard Time, and 10 a.m. Pacific Standard Time. Bring your questions.
Hello, everyone. Welcome to Ask the Good Doctor. I'm Dr. LaJoyce Brookshire. Thank you so much for joining us. Grab your Good Doctor notebook. You're not going to want to miss a minute of this. Join me on Instagram at Ask the Good Doctor and Facebook too, and on Twitter at Ask the Good Doc. We have got an amazing program for you today. As always, we come to you to help you attain, maintain, and reclaim your perfect health. Please, also, we want you to subscribe, yes, to my YouTube channel, to my YouTube channel. Yeah, yes. Please subscribe if you haven't already, and we invite you to like, comment, and subscribe. Today, we are going to continue a conversation that we started a couple of weeks ago about sustainability. And as we were told by our guest, Mr. Carl Tutt, that sustainability is a huge, massive industry. And it is also something that we absolutely need to be concerned about in our communities. We are going to get to the bottom today of talking about clean water, and sanitation. What might that be? But we've got some experts right here to help us along with this conversation. Back with us, joining us, is Mr. Carl Tutt from Integrating Green Technologies from Chicago. He is the CEO. Hello, Carl.
Hello, Dr. LaJoyce. Good to be back again.
Oh, it's so great to have you back. And also joining with him is his partner in crime, Mr. Sterling Laylock, who is also the consultant for the Integrating Green Technologies. Thank you so much for being here with us also, Sterling.
Thank you for having me.
My pleasure. I'm so glad to be here, that both of you are here. I want to break this down, because I don't believe that our audience, and Black and Brown communities at large understand the impact that sustainability has on our communities. And Carl, last time you were here, you told us that there were 17 sustainable goals that were set by the United Nations. Show us, Chris, about those and tell us about them. Carl or Sterling, both of you, tell us about them.
So we on the last show, we talked about how this came about. So these sustainability development goals were put together, established from the last show. It was established by the United Nations back in September 2015. And these are goals that basically the world said or agreed upon that these are the things that we should be focused on to impact the world and the people that live on it between now and 2030. And I'm going to tell you, in the last 4 years, especially with the last presidential administration, there hasn't been a lot of conversation around these sustainable development goals. And other countries around the world have grasped this, and they have taken off, and they're doing some great things. And we got some work to do. We got some catching up to do. But I think we're in a position where we can really start catching up right now into this next decade.
How so?
Well, when you look at where we are with the new administration, you already saw the writing on the wall just from the language leading up to the election. There was more discussion about climate change, more discussion about sustainability. And then when you see financial institutions, major financial institutions, focused on sustainability and talking about how it can accelerate the recovery of COVID-19, what we're going through right now, then you know it's real. And what I mean by that, companies like Morgan Stanley, companies like BlackRock, and BlackRock is the largest investment company in the world, over $7 trillion in assets. When they have a dedicated page to talk about sustainability, now you're talking about money. And so when people talk about sustainability, and Sterling knows about this, most people try to put it into a box and categorize it as, construction or building or something like that. No, it's far more powerful and far greater than that. Sustainability is how we're going to be doing business. It's how we're going to be living. really from now on, from what I can see.
Tell us about the importance of our community even needing to care about sustainability, because I know people in the Black community who say, oh, that green thing, that's not for us. This green, people who are talking about green technology and green living and clean living, they are denoted as like the flower children. They're vegetarians, they're all vegan. And that's the perception. And I know it's a misperception. Can you clear that up for us?
Yeah, it's a myth. I'm gonna let Sterling, because I know Sterling is chomping at the bit right now. so, I'm gonna let him in on that one.
So let's think about this in a very basic way. As soon as you turn on a light in your house or office, you're using water.
Mm-hmm.
You go and you buy a car. The amount of water that was required to manufacture that car, get it to the dealership so you could go in and buy it, is 40,000 gallons of water. If you buy a t-shirt, it's 1,000 gallons of water. And why would that be? Why would you need water to make things? It's because you need energy to make things, and you need electricity to make things. So when you create electricity, you have these turbines that are running. And the more they run, the hotter they get. The only way to cool them off is with water.
Mm-hmm.
So every time you use energy, you use water. So there's embedded water in every single thing that we do. So we've got to be much more reasonable, prudent, and aware of how much water we're talking about. And the way our systems work, we use clean drinking water to do everything, whether we're going to drink the water or not. That's just how the systems were designed. So we have drinking water being poured over a generator to keep it cool. And then once that water is, discharged into the ocean or discharged into a river, you can't recycle that water and drink it again. So all of this water, like 90% of all the water, is for manufacturing. Even if you go to a hospital, there are no magic chemicals that they use to sterilize the things. It's water at intense temperature. That's what's really going to kill pathogens. That's what's really going to get all the tools and various instruments prepared so that they can operate on the next person. It's not like a magic thing. So as we think about this, we've got to think more holistically, and we've got to think, well, maybe this isn't about eating vegetables for every single meal. Maybe this is about more than that. And as we look at all the embedded water in every single thing that we do, if we don't have water, we die.
Mm-hmm.
It's just that simple. Yep.
What will be that reckoning?
So as we approach going into the future, some of the things that we've got to do is we've got to assess what this thing is really about. Now, I'll tell you a little personal story about me. When I was about 10, and we moved from New York City to New Jersey, and in that summer, the milkman didn't come anymore. Adults were in their car with the odd, even gas rationing to buy gas. And on the television, where everybody had that little 13-inch black and white TV with the broken antenna, so you put a hanger in it and a piece of aluminum foil,
mm-hmm.
you saw all of these men on television in Washington talking about Watergate. So, of course, they didn't have any problem getting me to take out the trash or do any of my chores because I was cleaning out every single vessel I could find. And I was in the backyard with my German Shepherd, filling it up because they were stealing the water in Washington. And I knew it.
Okay.
But then no one was talking about it. My friends were talking about it. No adults were talking about it. So I said, well, maybe there's more to it. So I went to the library and I explained to the librarian what I thought the problem was. And she taught me how to use the Reader's Guide periodical. And I looked it up and then I realized there's more to it than that. And that's really what we have to do. Watergate was a break-in and all this other business. And then 3 weeks later, my father said, why is the Wall Street Journal and the New York Times coming to this house? And it's because at 10 years old, I started subscribing to that stuff because that's where I figured it out. And that's where I found out exactly what was going on.
Okay. Now we've got all of these buildings that are absolutely closed, all of the school buildings. Excuse me, you all, I had to switch devices.
That's okay.
All of these buildings that are closed. Does this present a health emergency for us with stagnant water in pipes, with needing to be closed because of COVID? We do understand that. However, what else is currently happening that nobody's discussing as we move back into school buildings and business buildings after they've been closed?
Mm-hmm. We have problems that are either too big or too complicated. We'll try to simplify it down to this one part or this one thing. Mm-hmm. But it's an excellent, excellent question. Because, we know that in Chicago right now, we're trying to get kids back in school. Teachers are saying it's not safe. There's some talk, not enough talk, about the indoor air quality. But there's absolutely no talk about the stagnant water in the pipes that you're bringing to our attention, Dr. LaJoyce. But it is critical because that stagnant water sitting there for 3 months, 6 months, 9 months, 12 months is the exact place where Legionella lives.
Mm-hmm.
What in the world is Legionella?
It is a really, really bad, very, very dangerous bacteria-based pathogen that as soon as you start turning on the water, you have water vapors that go into the air. Mm-hmm. And then you are breathing and you ingest the Legionella pathogen. And then you die, like really fast.
He said you really died. Wait, stop. No, sir. You don't get to, no, you can't gloss over that.
So what was the next point you would talk about?
Let's start over. The Legionella is the Legionella it's not a virus. It's a bacteria.
It's a bad bacteria. And, if you have a pipe, water sits in the bottom.
Yes.
Because no water's been flowing, so it doesn't flush through. And as it sits and sits and sits, all kind of little heebie-jeebies grow. Just because you can't see it doesn't mean they're not there. Hey. And then once you turn on the water, now that sitting water is coming through the pipes. You're washing your hands and there's water vapors. Like your nose doesn't feel wet, but you're still breathing in water vapors.
Sure.
But you're breathing in the Legionella bacteria.
Oh my gosh. And it is in the vapor.
It's in the vapor.
Mm-hmm.
Oh gosh.
So the water vapors become part of the air quality or lack of indoor air quality equation.
Ah, there you go.
So
the lack of the indoor quality equation.
Right.
So if we have the indoor quality equation is now, it's compiled of a lot of things now.
That's right.
Including that.
That's right.
Okay. So fellas, let's talk about what should be the standard protocol before opening a building.
One of the things that really needs to happen is you have to flush out all the pipes.
Yes.
How is that done?
With master plumbers that know what they're doing, and they turn on all the water inside the building to full force. And then they have a calculation that they come up with the time period that it needs to run, and you just flush out all of the pipes. Mm-hmm. Mm-hmm. It's very simple,
no chemicals involved.
No chemicals.
It's just a natural flow of moving that water. And over time, based on what Sterling is saying, they calculate how long it should take based on water flow and temperature that it needs to run until they believe that Legionella has been expired and taken out.
Like stagnant water is gone.
Yeah. Okay. Now, Are there sewage enforcement officers, sanitation enforcement officers? Who then enforces that this is actually done and done correctly before a building reopens, especially the ones that are housing our children?
Well, that's the tricky part. And the tricky part is that as you look at the ordinances and you look at the codes, there are many, many things that should be happening. But if we don't have the inspection and enforcement personnel to make sure it's happening, it sometimes happens and sometimes doesn't.
Okay, now let's talk about the environmental racism that we have endured. And certainly, hopefully you've read Harriet Washington's book, The Environmental Racism, that she's written an expose, amazing expose. And we're going to have Harriet on at some point. But I want to say that I'm sure the likelihood of this being done in Black and brown communities is a big fat zero.
Pretty much.
Yeah, no question about it. Because the consciousness is not there to do.
Right now.
That's what's happening. And we went through this in our discussion. We were talking about indoor air quality. When you have African-American and Latinx children that have a positivity rate that's 3 to 4 times higher than a Caucasian child, you have to have technology that levels the playing field. So what does that mean? You have to go above and beyond to meet the positivity level so that everyone in that room has the same playing field. You can't bring in inferior products. Otherwise, you're not solving the problem. And so these are things that are not being openly discussed. And they need to just put it on the table and say what it is. We got the data. It's been shown to us what it looks like, but no one wants to come to the table with options or with solutions that can create a better and safer environment for those children.
All right. I done told y'all that this COVID is not going to be the last plague, and it was going to precipitate other things. Now, here's one. Here is one. And so as we elevate our consciousness, as we scream this from the rafters, what then? Should we get a petition? Should we put the pressure on the school board? Should we put the pressure on whom?
We actually need to start getting our young people more involved.
Yes.
Because our young people are the future of what's happening. Yes. And when you think about it, especially, our millennials, they're concerned about the environment. They're concerned about what their world is going to look like as they grow up. They're concerned about when should I bring a child into the world. I mean, they're concerned about these things. And so we got to start to educate our children to be curious, to start Googling more, start asking questions of adults. The people are making decisions, these unilateral decisions, without bringing in all parties that are involved or that are going to be affected. I mean, you think about, you got some school system situations where the public school system is making all the decisions. They're not bringing in the parents. They're not bringing in the children. They're the teachers, the principals. They're not bringing any of those people into the discussion to say, what do we need to do to make sure everything is good? Because we're the ones that got to live in it. You're not living in it. So let's figure out what the solution needs to be so we can agree, we can feel safe, we can feel secure, and we know that when I send a child into your institution, they're going to come back the same way that they left this morning.
Amen to that. Isn't that every parent's hope, that our children would come back to us the same way we sent them?
That's right.
Because we're not supposed to cause injury. We're not supposed to cause harm in an educational environment, of course. However, if these things are not done, now you're harming not only that, but what about the staff? Not just children. Let's just talk about Legionnaire's disease. What happens? What is the antibacterial regimen for if you contract this? And when was the last time we even saw an outbreak of this in these United States?
Well, I'll tell you the first time and then the most recent. The very first time was back in Philadelphia, and that's when they discovered like what it was and how it acted and how lethal it was. And then most recently, I think it's probably in the last 5 years or so, the same thing happened in New York. And there was a doctor who he kept getting these patients in from Black, Brown, and Latinx community, and they kept testing positive for Legionella. They just kept testing positive. So what he did is he left the hospital and started going to the people's homes. He started testing the water. And then he realized what it was, because you can also get this from the condensation from the air conditioning system, right? Ooh. So, of course, he gets to the bottom of it. You know, like the show with the doctor, and then they break in people's houses. Well, he didn't break in people's houses, but he went into people's houses. He did this testing. And it turns out that it was Legionella. So now we are such a litigious society that no one wants to measure or verify anything that has actual data that's real. They want
my goodness.
Story about what happened. So they actually wound up reprimanding the doctor for going to these people's homes. So he figured out what happened. He figured out what to do. They looked at the corrective action. He solved the problem. And then he became the problem.
Mm-hmm. Oh, my goodness.
And that's the society that we are living in. And we really have to put a stop to this, like right away, especially because we can burn up or drown from sea level rise and everything else, and have all kinds of migrations of people leaving coastal areas and coming inland and causing big disasters. Mm-hmm. So we have to get our minds right around this to see exactly what it's about, get real about it, stop with feeling tender about it or worrying about who's going to sue who. You see with COVID, they said, no. There's going to be no liability to the businesses. They also have not said, in order for the businesses to have this immunity, here are the things they need to do to qualify for the immunity. No, they just want to give it to them in a blanket way. And then if you go into an environment and it's not safe for human health and safety, too bad for you. And that's not right. It's not right.
Oh, goodness. Now, okay, in addition to these school buildings, so we know what we have to do, everyone. We have to take some action. We have to put the pressure on our school districts. We have to put the pressure on the managers of buildings that we go back into after they've been closed, after not working. We have to ask the questions. You know, my daughter has always been the kind of little girl that if you don't ask the right question, she's not giving it up. But if you ask her the right question, she'll tell you anything. All right. So we have got to be like that. We have got to start asking all of the questions as we enter back into our workplaces and into our educational environments. Fantastic. So now that we're in the educational environments, sustainability, gentlemen, we need to take certain precautions. We need to because of course, being asymptomatic with COVID, we have no idea who is and who is not infected, which poses, of course, a problem, which is why we want to mask. But also there's another problem in public spaces, shared spaces, intimate spaces like the bathrooms. Mm-hmm. Say more.
Well, as we look at, say, a bathroom stall, use the toilet. It's a public bathroom. It's not like your house. It doesn't have a lid. And when you flush, vapors are going in the air, just like the Legionella. So now you have fecal matter all in the bathroom. Can't see it, but it's there. Mm-hmm. Then as we look at going in any building, especially the schools, you say, listen, we either don't, or unable or unwilling to test everyone. I think that's a mistake. You got to test everyone to go back to school, even if you do the rapid COVID test. But ongoing, if you really want to know if you're about to have an outbreak, if you have people who are infected, it's very simple. We test the sanitary water coming out of the bathrooms.
Yes.
Because once we do that, the virus let's say it doesn't take hold, you're asymptomatic and it's trying to work its way and do its thing, but you use the bathroom, the virus multiplies, but then it dies fast too. So it sheds. So you're going to find it in fecal matter. And it's a DNA-based virus. So they could even say, it's me that has the virus. And why? How would they be able to do that? Because federal, state, and county databases with DNA information that they're constantly collecting on everyone. And let's say they didn't get your DNA that way. Well, you voluntarily gave it to them, didn't you? And how did you do that? You signed up for Ancestry.com at 23andMe.
Oh, you stop it now. Okay. Pause, young man. Pause, sir. Because we are going to have a show on that.
Yep.
All right? I keep saying that.
You paid them to give it to you.
Wait, before you go any further, I want to show this video, which underscores the trouble that we're going to have, that we are having, that has not been spoken about in public places. And this is a scientist being interviewed by this woman. Take a look at this.
How can you protect yourself in a public restroom, especially during this coronavirus outbreak? I learned something doing this story. Ever heard of a toilet cloud plume?
It's what's produced when you flush a toilet.
I'm talking with Mayo Clinic's infectious disease expert, Dr. Greg Poland from Mayo Rochester.
It's kind of gross.
It is gross. Gross or not, Dr. Poland says, especially now, we need to know about this plume thing.
Which very effectively distributes virus or whatever's in there on everything in that washroom.
So he says, flush with your foot and turn away fast. And if you grab faucets and door handles, stop.
Do not do it. They are grossly contaminated with fecal bacteria.
So use a paper towel. That's an easy fix. Okay, and one more thing, and you might think I'm kind of weird, but I always look at the toilet paper dangling down there, and I think, is that part down there bad to touch? Is it possible there could be coronavirus on the end of that toilet paper?
Yes, if that person sneezed into their hand, grabbed the toilet paper, ripped it, and their hand touched, the part they didn't pull away, yes, virus can persist on that.
Is it likely? Probably not, but it can happen. So I'm glad I asked. So I'm not totally stupid by tearing that part off and throwing it in the trash?
No.
Good. I'm big on better safe than sorry. Now, also remember, when you get soap, don't touch that soap container with your fingers. I see people do that all the time. They're pumping the soap container. Don't do that. Don't touch that either. Use a paper towel.
Oh my goodness. I'm so glad to see an infectious disease doctor from the Mayo Clinic have this conversation. I've been having it here for quite some time. Listen, I don't touch anything with my bare hands. All right. I always wear a glove. I always carry a tissue or a paper towel. I keep a handful of paper towels. I keep packages full of tissues. Get them at the Dollar Tree. They come in a package of 8, and there are 8 of them in here. You take them out really easily. I don't even use the toilet paper in a public stall, just for the reasons that she is saying.
That's right. And this is not a germophobic situation, because people say, "Oh, you're just so germophobic. What's the big deal?" No, it's the big deal.
I'm that too. Let me admit that. Yeah, I am.
But these are the type of precautions that you need to take right now, and probably going forward, to just start getting into the habits. This becomes a habit of living that we're going to have to contend with. And after if you start doing it for so long, it just becomes ingrained, and you just start doing it, and you start passing it down to your children and everybody else, and then it becomes a normal part of living. So I see that happening.
Actually, when my daughter was 2 years old, she just made 19 the other day, we saw an experiment on the Oprah show where a scientist had a black light, and he showed the difference of the matter in the toilet being sprayed with the toilet seat up versus the toilet seat down. And the difference in how far it's sprayed all around. Oh my goodness. From that day to this, we've been shutting the toilet seat. And when I was doing the research for this, I saw in the New England Journal of Medicine. Now, how many people run around reading the New Journal England of Medicine? Okay. I New England. Okay, I do, just like you read the Wall Street Journal. Okay. But I read an article there that said it takes about 20 flushes to adequately clean out what was left behind by a singular person in the toilet. 20 flushes unless you disinfect it yourself. So we're back to prevention, taking every precaution. Carry these around. They are sturdy. They're $1. They come 3 in a pack, loaded up with peroxide. Peroxide is one of those things that has not gone up in price. Peroxide kills the virus, right, guys?
That's right. Yes, it does. And nobody's talking about that.
Nobody's talking about it. It's cheap. It's safe. It's effective. It won't kill you. It's not a quaternary disinfectant like bleach and some of those other disinfectant cleaners and Lysol and such. Quaternary disinfectants that are known carcinogens. Peroxide is still less than $1, and you fill that up and it'll kill anything in the toilet. All right? Do that for yourself, then go. And for God's sake, don't sit on the toilet seat. Carry around your own toilet paper, carry around your own paper towels, and wipe yourself with your own toilet paper just for those reasons. When I see that toilet paper hanging all low and touching the bar in there where, for the handicap, all I think is germs, 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 germs. So the point then that's being made, that's not being made in public anywhere, hard to find this information, is that if in the droplets, the virus is located, as we know, which is why we're wearing a mask. But fellas, isn't sweat a droplet? Aren't tears droplets? Isn't your pee droplets? And aren't there droplets in your poop? And what makes us think that the virus is not transmissible through, we know it's transmissible, it's saliva transmitting it one person to another, we know that. So then kissing, so then vaginal secretion, semen, this is sexually transmissible.
That's right.
Know it. Protect yourself. You have to be vigilant. Take every single precaution. Peroxide, you all, it cleans the toilet. Practice your straddle at home. Practice. I learned how to straddle over toilets in college. Those nasty chicks in college, oh my gosh. You really find out what women are made of when you got to live with them. Sorry, I had 6 brothers. So I wasn't used to that. I was like, oh my God. So I was floored. But that practice your straddle. Don't sit on toilet seats unless you're going to clean it. These also come with a spray bottle too. Some of them have a spray bottle in them. You can spray it on the seat if you must sit down.
Right. And the other piece too, we talked about this before, Dr. LaJoyce. What happens when someone dies from COVID?
Okay.
There's no protocol on that.
I need let's review, because at risk are the people at funeral homes. How are they? Okay. Is there a mandate to cremate the COVID bodies? That's what I want to know.
I have not seen a mandate. Actually, from talking with funeral directors that are friends of mine that I know, there's been nothing that's come to them that gives them protocols on how to handle people that died from COVID. And so they're trying to figure it out on their own, just from a precautionary standpoint. And so they're in some cases like hazmat suits. Because once they've identified this person has passed away from COVID, they don't know how long it stays in a person that died. How long is it active? And so they have to be careful.
Right.
And then and what you're going to start seeing, and you may have seen it already, funeral homes are putting a separate charge, like an upcharge, for dealing with a COVID person that died. Because it's equipment, there's more things that have to take place to protect the people of that company so that they can do their job properly.
Oh, gosh. You know what? Don't go away. We're going to take a break, just a pause, and we're going to explore that more when we come back. So if you have not grabbed your Good Doctor notebooks already, get ready, grab your Good Doctor notebook, and we'll be back right after this.
Hi there. Thank you for joining me. I am at the Essex Culinary Resort and Spa, and I am in a therapy room where you can come and get pampered and get hands laid on you. I had the most amazing massage the other day. It was just totally awesome. Listen, they curate all kinds of things special just for you. Peppermint, hot stone, maple syrup. We are in the land of maple syrup. So won't you join us for the Wellness Warriors Weekend Getaway, June 2021. I'll be here. I want you to be here too. Don't miss it. These are all of the beautiful things on the ceiling at the formal restaurant at the Junction at the Essex Culinary Resort and Spa. Right here, this is the chef's table where you can sit and have an incredible meal. I am here to tell you that the Essex Culinary Resort and Spa has the most amazing restaurants. The food is farm to table, and it is fabulous. So join us for the Wellness Warriors Weekend Getaway in June 2021. Hi there, we are at the outdoor pool at the Essex. Look at this wonderful waterfall. You stand under this, and this is like, oh my gosh, it's exfoliating. Wonderful. What a beautiful poolside to sit at the Essex Culinary Resort and Spa. Don't miss it. We'll be here for the Wellness Warriors Weekend Getaway, June 2021. I'll be here. Join me.
Yes, and if you'd like to join us at the Wellness Warriors Weekend Getaway, please do. Dr. Brookshire at Outlook.com. Send me an email at drbrookshire at Outlook.com for more information and how to register. All right, gentlemen, we were talking about with Mr. Carl Tutt, from the CEO of Integrating Green Technologies, and Mr. Sterling Laylock, who is a consultant with Integrating Green Technologies, about sustainability in the Black and Brown communities, specifically clean water and sanitation. And we had just started to discuss before the break, funeral home protocol. Oh my goodness. Mm-hmm. Here's my greatest concern. Isn't the Department of Health the one that governs the rules and regulations for funeral homes? Have they just not gotten around to talking to funeral home directors about COVID protocols?
They haven't gotten to that point yet because they're still trying to figure it out. The science has not told them the best information to provide to funeral homes. And so that's why they're asking. I mean, the funeral home directors, they're asking, give us information, help us so we know how to best do our business. And they're not getting that information yet because it may be because they don't have the information to give. They're still trying to determine how to figure this thing out. But we do know right now that what funeral directors are doing, like I said, they've got their hazmat suits on that they throw away after each client that they deal with because they cannot keep that around because they don't know whether that patient or whether that person is still emitting COVID particulates. Because you think about it, when you're going through an embalming process, there's things that you have to do. And when you're opening up a cavity or opening up that person, you don't know what's emitting from that person. And so you have to stay safe.
You have to stay safe.
And I'm sure Sterling probably got a couple of things he want to say about that one too.
Please.
Well, let's just take a few minutes and say, well, how could that be? What do you mean they don't have rules for this? The way that our regulatory community works and our government works is a bit backwards.
Huh.
And the reason for that I'm sure they had a number of valid reasons why they do things the way they do when they decided that's how they were going to do it. But it doesn't apply today in so many different instances. We know that prevention is much better than a cure. We know that prevention is cheaper than a cure. And we know that prior planning prevents poor performance. And when you go to the Principles of Management course at Dr. George Clark back at Florida A&M School of Business and Industry, if you're on time, you don't get locked out of the class. And if you get locked out of the class, if you're late, you're absent. That's how he rolled.
Ooh, I love it.
You're late, you're absent. So you know that whenever anything happens, there's this call for a state of emergency. You know why they do that?
Why?
Because they can't spend any money on anything until the governor declares a state of emergency. So if you start trying to spend money on preventing something that you know can happen, you are mysteriously misappropriating government funds because they don't spend money to prevent things from happening that haven't happened yet.
Yeah, that's not a budget line item.
Nope. And in order to deal with climate change, sea level rise, pandemics, pathogens, and all the things we're talking about, we're going to have to change that. We're going to have to get ourselves into a mindset that says we need to design the way we're going to operate. We need to design the way we're going to prepare. We know already the things that are coming down the pike. We also know the things that are happening now, even though the public doesn't see it yet. The only reason the government does anything is because of public outcry.
That's right.
Emergency. And then we're going to get Apollo 13 back to Earth with 2 paper clips, 13 rubber bands, and a vacuum cleaner bag.
That's right.
We do.
I mean, that's a fact. But when you think about what Sterling just said, what does that mean? We're reactionary people. We're not forward thinking. And so that goes back to those 17 Sustainable Development Goals. Those goals were put in place to be forward thinking.
Yes.
For prevention of bad things happening.
Exactly. And like I said, we have not been exposed to that like we should have been because of the last administration. It's been ignored. Climate change didn't exist in this last administration.
Sure enough. Well, it existed, but it was not addressed.
It existed. Oh, yeah. It was there.
Yes. My father always says, it seems like we're always trying to close the barn after the horse is out. And you cannot catch a wild horse.
No.
You can, but with great effort.
That's right.
And risk.
And risk. This fits so beautifully into the model of naturopathy in terms of what I do as a clinician, in terms of ensuring that we are maintaining perfect health and attaining and striving for it as well. But the model for a cure is prevention. Absolutely. There's a cure for everything, and it's called prevention. And there's a whole lot more to staying well and staying healthy in this COVID season, in addition to washing your hands and wearing a mask, although important. But as we just saw in that video, washing your hands is not enough if you're going to touch the faucet with your bare hands.
Exactly.
And then walk out of that door. And I can't stand to see people use their sleeve. Now you're dragging it around with you all day.
And then you put your elbow on the table.
So what does that tell you when they do that? That tells you that they're thinking about them and nobody else. That's what that action means.
There was once a lady I spent a lot of time with. She was a school board member in Atlanta. And for 35 years, she taught kindergarten. So of course, everyone was in the kindergarten. Everyone had a name tag, right? And she would say, honey, they would do better if they knew better.
Yes.
They would do better if they knew. Didn't matter what it was. That applied. And we're in a situation where we have to start to get real about things. And we have to start to understand it's not about intellect. It's about design. We can design the way we're going to make decisions. We can design the way we're going to interact with each other. We can design the way we're going to occupy buildings. Buildings basically house us and our stuff.
Mm-hmm.
That's what they do. And if we don't design how we're going to have cleaning and sanitization, how we're going to deal with indoor air quality and indoor water quality, how we're going to do our stakeholder engagement, who's going to be responsible for what, and where do I go? Who do I contact if I even think that there's something that's happening that may impact my good health and well-being, or that of my neighbor, or that I see someone, maybe they're coughing a lot. Like, what should I do? You see, in the airline industry, the flight attendants are saying the biggest challenge on their job is getting the people to just wear the doggone mask.
Yep.
Right? So we are now in a situation where we don't have an option. We don't have any choice. And as we look at these sustainable development goals, we know that number 3 is good health and well-being. So what do we want? Why do we want those things? And what are we willing to do to get those things? And anything that does not answer those questions and does not point to successful outcomes and results, we should not be doing.
Mm-hmm.
The last time you said a mouthful about indoor air quality, and Carl talked about that a little bit superficially the last time he was here. What really blew my mind about talking about indoor air quality, especially in buildings like schools and businesses, was the fact that it's not enough to have a filtration system. Tell us why again, Carl.
So when we were talking about this, we were talking about how a solution for one school system was to put air purifiers in the classroom. These air purifiers that we looked at are ones that would cover 500 square feet or less. So like a bedroom, something like that. But we also know that the average size of a classroom is about 1,040 square feet. So now you have a deficient piece of equipment in the classroom. So let's go a step further. So let's talk about the air purification, the system of air purification. So air purification is like a reverse fan. Okay, so it's not blowing out air, it's pulling in air, it's pulling in particles that are in the air, particulates that are in the air. And those particulates, they settle into a filter. The real issue is those particulates don't die. They're just in the filter. Right. And so now you have to start thinking about, okay, well, at what point do I clean the filter?
Yeah.
Who's going to clean the filter? Is the teacher going to clean the filter? Is the maintenance guy going to clean the filter? What type of equipment do I need to clean the filter? What type of solution do I need to clean the filter? What happens, if I have to clean the filter in the middle of the classroom? Also, where's the monitoring to make sure that the air filtration is working properly? We have the right CO2 level there? Are we going to exceed the CO2? What happens if I exceed the CO2 level in that classroom? What do I do with the children then? So all these things have to go into the process as part of the protocols and procedures that need to take place. And from what we can see, folks are not thinking that far.
No.
They try to pick up on one or two things and just do those. And then they're saying, well, but we're going to sanitize and clean every night. And we're going to use the cleaners and things that the Centers for Disease Control have approved that could kill COVID. Well, that's the stuff with the skull and bones on the back.
Yes.
And now you're doing that every day. So now that's becoming part of the indoor air quality. No one incorporated any training for the facilities people. So they come in and they turn off your air purifier because no one's in the room. So it's not continuously
Oh
cleaning.
my gosh.
And when you come back in, now you're walking into a toxic environment.
Yes.
Now, we don't think like that. Like if we say, oh, it smells fresh, that's toxic.
That's it.
That's
That's it. Injuring your lungs.
Mm-hmm.
Okay. Now, this is problematic because these are what are called quaternary disinfectants. Those would have just skull and bones on it.
Mm-hmm.
Right.
Don't you dare drink that. Get that stuff out of your homes. And then people go home and use them too.
Yeah.
So now they're sitting up under it. It's just as bad as having fluorescent lights everywhere you go and then having fluorescent lights at home as well. This is part of the problem. And this is just injuring us bit by bit by bit by bit.
Yeah.
And then when something comes along like a COVID, then you wonder why.
Yes.
It takes out an entire, because you have tampered with my immune system, which is why I wish we'd just get to that conversation and watch that little cartoon woman make a nice plate of vegetables, watch them make some smoothies or something that's going to improve your immune system. It's warfare out there.
That's right.
It is just, and let me say something there. This is not going to be the last plague. Y'all should know that.
Oh no.
I keep saying it, and they're amping up for it. They're getting us ready to tell us about other stuff that's coming, because it's coming.
Well, let's look at something as simple as, wildfires in California.
Mm-hmm.
Everybody saw The Lion King. When something bad is getting ready to happen, who's the first one to start getting out of there? The animals.
Mm-hmm.
Go where they're going and do what they're doing.
Mm-hmm.
So what that's causing is for animals to now be moving into environments to move away from the danger. And then they are in urban areas and other places that they ordinarily wouldn't be. And then they're carrying disease, other different kinds of natural elements that's normal for them, but not good for us.
Mm-hmm.
You go in the woods, you better be ready. So, one of the things that I sort of picked up on in the piece was the wonderful tranquility of getting a massage. So, you haven't had that happen in a while because we've been in the COVID, right?
Mm-hmm.
And then that wonderful kitchen, and you could hear the vent fan for the grill going on in the background. You have to have that. You go in places, they don't turn it on. Why? Because they're trying to save energy, because the bill is high. But what is grill smoke? What is it really?
Mm-hmm.
Smoke is grease.
It's grease.
Grease.
Mm-hmm.
So you go into a restaurant that has either not cleaned it, not maintained it properly.
Oh boy!
You see the smoke, and it smells great, the barbecue, but you're breathing in the smoke, which is another toxic carcinogen, which is making the indoor air quality a disaster. So just like Carl was talking about with the indoor air purifier, you cannot be in a 100-year-old Chicago public school, which doesn't have a window and doesn't have an exhaust to outside, and you are filtering the air and returning that air in the same room. Now you're just recycling the virus and spreading it even more. So you've got schools with no central air.
Yeah.
And then they have no window. So that's two ways you're going to have to figure out how you're going to deal with the ventilation. Then you have schools with central and no window or a window. So you cannot have just one way of dealing with the indoor air quality in the school system in a one-size-fits-all with a machine that isn't even adequate enough to cover the square footage, because you've got different scenario in different classrooms in different schools. So you need at least 6 different ways of dealing with, if my classroom has no window but I have central, if it has no window with no central, if it has outdoor air duct, way to exit the air, what is going on with my particular classroom? And if I were a teacher, I would have my very own indoor air quality monitor for a couple $100, and I would pull it out of my bag in the morning and put it on my desk, because I know that if I stay within a temperature, humidity, and CO2 reading, I could be at that point where it is not conducive to exacerbating or helping the virus stay alive. It's in a realm where it is difficult for the virus to stay alive.
Mm-hmm.
All right now.
That's what you got to do. So we have to think about the solution aspect of it.
That's it.
And so, and so the first thing,
because you're about to make me cry.
The first thing I would think about is, what are you gonna cry for?
Why are you gonna cry?
Because I'm a teacher.
Okay.
I'm a professor. And I'm thinking about all the other, but more than that, our children.
So when you think about that, Dr. LaJoyce, you think about what's the best type of environment for our children to be in? The best type of environment is for them to be in a fresh air environment. Mm-hmm. And so how do you do that? Well, you think about each area of the school, because we're talking about schools. So you talk about each area of the school and you start to map out what type of technology do I need to have in each type of room in the school to make sure that I have the best air quality in that room, regardless of the HVAC system that you have. So we're not even going to talk about that. We don't even focus on that. But you want to create an environment that will kill pathogens in the air. That's the first thing you want to think about. You're not worried about, wipes and sanitizer, which is flammable in the school now. You're not thinking about, how to disinfect, because first you have to clean before you can disinfect. So what do? I create an environment that is so clean, it's like being outside. And you say, well, how do I do that?
Yes.
Well, you would create what's called an ionized environment.
Right. Okay.
And you think about how you can make that happen in every type of room, whether it's the lunchroom, the bathroom, the band room, the art room, the chem labs. You want to figure out, what does it take? Because once you have the design, go back to what Sterling said. Remember he said design?
Design.
You got to have a design for each type of area that you can replicate no matter where you go. That should be the overall focus to start dealing with everything that needs to take place within these schools.
I just saw a comment where someone said, I'm in an office and there's no windows.
That's right. Someone just said that.
So what do? We still could have an indoor air purifier, but we could have an indoor air purifier when it sucks in the air. Then you would have a hose in the back, like the dryer at your house.
Yes.
It's connected to the wall, and then there's a vent to outside.
Mm-hmm.
And then you have ionization. And to understand ionization is what happens in nature when nature cleans the air.
Mm-hmm.
Trees, chlorophyll.
If you go to like a waterfall, we always feel wonderful. Why? Mm-hmm. Because that waterfall effect creates ions.
Mm-hmm.
That's right.
You walk in the woods. Why does the air smell so much better? It's because ions are being created. Now, here's a caution. Right when it's about to rain and it smells so sweet and wonderful, and we all run and open all the windows in the house, don't do that anymore.
Yep.
And the reason you don't want to do that is because it is toxic to you. It's toxic. Because think about it, the ozone in the air is being cleaned when it rains.
That's right.
So when you smell that sweet smell, that's ozone. And if you do anything with ionization, you want to make sure that it meets the most stringent standard with third-party testing for no ozone. Meaning no more ozone than you're going to find in the natural air, whether you have ionization or not. All of these things are super, super, super important. Not super expensive. You don't need new construction. You don't need all these other things. These things can be retrofitted inside existing buildings, and we can have good health and well-being.
So let's bring this back. Let's bring this back full circle. So now the question would be, what is the thing that would impact ionization in nature? What is the danger, or what is the predator of ionization in nature? It's climate change.
Okay. All right. Time out. We are not touching that today. That is a can of worms and a deep dark hole. I promise you we're going to get to it, audience. I promise you we will. Right now, you've just left a lot on our minds, okay? And one of the things, and do you like the Vollara air purifier? And what other kinds do you like?
We don't go by brands. We look at the third-party testing of the standards, but the main thing is, what is the quality of the filter itself?
Mm-hmm.
And how many times per hour can we change that air and clean it?
Right.
And you really want to be around 5 to 6 times per hour to clean that air.
All right.
So you now follow the CDC guideline on this, okay? Because there is a CDC guideline, but their CDC guideline is usually like 2 to 3,
which is average.
You can't, in an environment like this, you cannot be average. You have to be above average.
Above average. Oh, absolutely.
Okay? And that's why Sterling is saying 5 to 6 times. So actually double what CDC requirements are.
Like every 10 minutes, cleaning out all that air in the room.
Yeah. When you see this, when you see the word guideline or requirements,
that's the minimum.
Think minimum. That's the minimum that you need to do. But your situation may not be minimum. And so you got to think about what's best for your situation.
What's the maximum? Okay.
Mm-hmm.
Oh, God. Fellas, you have put so much on our minds. We've got a few questions here. Rose wants to know, how closely related is sustainability with the World Economic Forum, where we were told that we will own nothing and be happy?
Well, that is
Rose,
a brilliant question. The World Economic Forum is run by people that don't live in the real world because they are in a bubble. They are not impacted by the issues. If the virus comes out today, they get injected tomorrow if they want to. And they are not trying to figure out how to, balance their checkbook or where, if their house doesn't have the adequate indoor air quality, they just get another one. So they should be the last persons talking about, especially that bottom half of the 7.3 billion people that live on planet Earth, because they're completely unrealistic and they want everything typically for themselves and very little for anyone else. So they want you to don't worry, be happy, and have nothing.
Okay.
And you should like it.
Ha! Yeah, we're not going for that. Like my husband would say, kick rocks. Josanna wants to know, how does the Legionella kill us? Does it kill quickly or slowly?
It can be both, depends on how dramatically impacted someone is. So, people can recover from it, but you have like these charts that say, if you get this disease and you're in good health, this is the percentage chance of you surviving it. Now, you could get Legionella and have an unfortunate occurrence where you're in a part of the country where the doctors don't really have a lot of expertise in Legionella or how to treat it. So it's not just access to healthcare, it's do you really have the experts that would even be able to diagnose and know that that's what the problem is?
Yes.
So the best way to not have to worry about Legionella is to not catch it in the first place.
Say it. Prevention. We're back to that.
Right. And you got to think about the same way as you think about COVID right now.
That's right.
Okay? When you're being attacked, when your body's being attacked, where does it go? It goes to the weakest areas of your body first.
Yes, it does.
Okay. And so when you have pre-existing conditions, it's the same thing. So look at Legionella the same way you look at coronavirus.
right.
Okay. So Laverne said she's always ripping off that hanging toilet paper. Stephen said, wouldn't it make it hard for the school to keep up with talking about the air purification and the water?
It would be, but if it was easy, it wouldn't matter.
Mm-hmm.
And really what the public should be saying is, we want the testing of the water coming out the bathroom because you get a week head start to know if you're going to have an outbreak in that school.
Oh.
Because it sheds first. So if someone's infected, it's going to shed before you all in there with it having the ability to spread, because it has to really take hold in me in order for me to then be able to spread it. Now, the University of Illinois, Chicago, in their School of Public Health, is already doing this kind of testing around the city and at the treatment plant. Mm-hmm. So if you're the school system, I'll bet you if you have a little bit of money, you can at least look at those zip codes that are the most impacted areas, and piggyback onto their study. Even if they say, well, we can do it, but we have to work it in for phase 2. You would then be able to have that information, and it is way less expensive than having to test everybody who then is going to maybe test negative and go home or be with their family. People are inside, it's cold. And stop listening to the school people when they keep saying that nobody catches the virus at school.
Oh, that's the virus. What a lie. Oh, what a lie.
That's a crazy world. Crazy.
Mm-hmm. I have a friend who's just getting over COVID right now. Office manager, one of those who refuses to wear a mask. She let down her guard on one day, took off her mask, thought she was far enough from the woman and caught COVID.
Right.
She did, and brought it home to everyone in the family. Unfortunately, they did recover. They jumped right on the protocol that I have, and they recovered. I have a question about the Legionnaires. Last question I think this is the last question I'm going to bring up about this. But how long must a building be empty before that settles in? Is it 1 week, 1 month, 3 months?
It depends on how much maintenance and what protocols they've been doing ongoing in the building.
Okay.
But you figure if it's my building and people were coming there every day, and then we decided the building's gonna close for the month, when we go back in, I'm doing it anyway.
Yes.
Because it's not gonna hurt. You're just gonna use a little water. Now, in other instances, let's say people are they're just like fixated on, low flow shower head, low flow this, low flow that. Well, there is also an equilibrium point where you have to be mindful about the whole consumption and reduction, because you still have to have enough water going through those pipes to flush them every day. You can't get but too crazy in even saving water, in water conservation in a building, because those pipes are designed so that a certain percentage of the volume of that pipe has to have water going through it. If it's too low, now you got the pathogens and everything growing around the pipe.
Around the pipes. Okay.
So there's an equilibrium point that you really have to understand.
Got it. We've got a question. I'm sorry.
So keep it simple. Okay, think about it like this. Why do you brush your teeth twice a day? You brush your teeth twice a day to break the bacteria cycle, because bacteria builds every 24 hours in your mouth. And so you brush your teeth twice a day to break that bacteria cycle. Take that same thought process and relate it to stagnant water in your pipe.
Okay.
If you're not flushing it, that bacteria is building up.
All right. Okay. Understood. Here's a question from Not Manny. What is the first step to changing youth mindset to be more forward thinking? It was previously mentioned, and I'm curious as to how we can influence others firsthand.
Every single grandmama, grandpappy, auntie, mom, dad, uncle, should really be jumping up and down, kicking and screaming, and saying dealing with this coronavirus pandemic is the perfect environment to do science, technology, engineering, art, and mathematics, because they touch all of them. And all these CDC guidelines and all these things should be taught to the children. If you get a chance to go to a career day, if you get a chance to do any kind of public speaking to the Boy Scouts, to the Girl Scouts, to the youth in the 100 Black Men, or any of these groups, include elements of teaching the children how to take care of themselves in their own good health and well-being, and relate it to things that are important to them, like wiping off the screen of your iPad or your phone in the video games you be playing all the time. And then you put your hands in your mouth or you rubbing your eye.
That's right.
See, simple things.
If nothing else, I would think that these COVID times, as we have been COVIDing, that we have learned a different skill set on how to maintain our well-being. Right. That would be my hope. Well, I want to thank you, gentlemen, for joining us today. We are going to continue this conversation. We'll get you scheduled. I know it's hard to get the two of you together, but we have to get through all 17 of these to figure out, and we have to get to climate change as well. So you all just let me know the next time you're available. You just come back to us whenever you're ready as we continue sustainability in the face of COVID. Thank you, Sterling. Thank you, Carl.
Thank you.
We appreciate you. And I will put in the chat your email address, right, Carl?
Yes, you can.
Okay. I will put that in the chat on how people can reach you. But thank you so much for being here with us today. Final words.
All of these things have fundamentals. Simpler is better. And we've got to look at how we're going to design on purpose the way we're going to operate, maintain, and keep ourselves aware of what's important, and always be on the lookout for what's missing, what they're not talking about. And when you see certain keywords in different articles, start searching those keywords, and you will find a lot of times the answers to what you're looking to try to discover.
No, you didn't say this, what they're not talking about.
That's right.
Yes, yes. What you don't hear.
I've never heard any guidance from the federal government or what we should be eating or what we shouldn't be doing so that we can have a better immune system for COVID. They're just telling us social distance, wash your hands, stop talking to people, and wear 2 masks. They didn't tell us what we should be eating, what we shouldn't be eating. You have to drink more water. You need to eat more vegetables. None of that. They haven't told us any of that. They just said, we're going to have this magic virus, a vaccine for you. That's all they said. They didn't tell us how many times we're going to have to take it, how long we're going to have to take it, how long it lasts. They haven't told us any of those things.
Okay.
And one quick thing I would add is, because our children are out there, they're suffering.
That's right.
And so what you want to do, this is for parents and grandparents, when you identify that your child has fear and anxiety that's toward what's going on with coronavirus, help them turn that into power. How do you do that? You do that by stopping what they're saying and said, let's start looking some things up. Let's provide facts for you, because things are coming at them. They're in an environment that there's stuff coming from everywhere. But we want to settle in to where they can start to answer questions for themselves. And so you got to teach them how to do that. So that takes the anxiety off of them because they're more knowledgeable now.
Okay. All right. Well, we want to empower you. That is what we are here to do. I count myself as a disseminator of good information, useful information. And I just want to thank you all for being here with us today to share with this conversation. It's so important. There are not many people who are aware of this. I am going to encourage all of you watching today to like, comment, share this information. People always come back later and watch this, and we want you to share it until you can't share it anymore, because if these are action plans, and these are solid solutions on how we can eradicate a thing circulating right now. And it's been a menace to our society, and we are tired of it. and we can say no more. So thank you, gentlemen, for shedding the light on the situation. We thank you, thank you, thank you. Thank you all for joining us. I want to thank my team. Thank you, IW, supervising producer, Chris, technical producer, my interns who are in the background there, and my moderator, Black T. Thank you, announcer Cheryl Hines. And remember, that does it for me. To let your eyes shine, cut back on the wine, get good food fast, and go easy on the greasy. Until next time, I'm Dr. LaJoyce Brookshire, here to help you attain and maintain your perfect health. Let's do it again next week, okay? God bless you.
Hi there. Thank you for joining me. I am at the Essex Culinary Resort and Spa, and I am in a therapy room where you can come and get pampered and get hands laid on you. I had the most amazing massage the other day. It was just totally awesome. Listen, they curate all kinds of things special just for you. Peppermint, hot stone, maple syrup. We are in the land of maple syrup. So won't you join us for the Wellness Warriors Weekend Getaway, June 2021. I'll be here. I want you to be here too. Don't miss it. These are all of the beautiful things on the ceiling at the formal restaurant at the Junction at the Essex Culinary Resort and Spa. Right here, this is the chef's table where you can sit and have an incredible meal. I am here to tell you that the Essex Culinary Resort and Spa has the most amazing restaurants. The food is farm to table, and it is fabulous. So join us for the Wellness Warriors Weekend Getaway in June 2021. Hi there, we are at the outdoor pool at the Essex. Look at this wonderful waterfall. You stand under this, and this is like, oh my gosh, it's exfoliating. Wonderful. What a beautiful poolside to sit at the Essex Culinary Resort and Spa. Don't miss it. We'll be here for the Wellness Warriors Weekend Getaway, June 2021. I'll be here. Join me.